My name is Dr. Dagoberto Gonzalez, and I'm a physician at Hormone Balance of Laredo. And we're here today to talk about the misconceptions and myths of testosterone replacement therapy in women. What we have done is compile the most common questions that we get asked in our everyday practice about testosterone in women. We've written these up, and Becky, who's here, she's going to be reading them out to me, and I'm going to be talking about them.
All right, question number 1. Is testosterone only a male hormone?
Okay, so this is a very common question. When we talk about replacing testosterone in women, most women are very surprised that we're even talking about testosterone or even thinking about replacing it. But testosterone in women is the most common biologically active sex steroid that they have. It is actually found 10 times higher when compared to estrogen. And that's throughout the entire woman's lifetime. So even though it's typically labeled as a male hormone, it's actually the most common or the most highest amount of steroid in women. So it's false. It's actually a woman hormone, just as important.
All right, next question. Is testosterone's role in women only for sex drive and libido?
One of the most common questions we get asked in our practice is, I have a decreased sex drive. What can I do about it? And when we talk about testosterone, they immediately start thinking that the only purpose of testosterone is to increase sex drive and libido and for them to be more sexually active. And yes, it's true, but that's not all it does. We know that we have testosterone receptors in every single part of the human body. That includes the breast in women, the heart, the liver, the skin, the hair, the nails, everywhere. So testosterone plays a very active role in a woman's body. So sex drive and libido is just the tip of the iceberg of the benefits that women can get from testosterone replacement. And some of those benefits include increasing the quality of life, like mental fog, lack of sleep, joint pain, muscle pain, no desire to do anything, lack of sleep. Those are typically symptoms of testosterone deficiency and not estrogen deficiency like most people think.
Does testosterone masculinize females?
Well, yes and no. For the purposes of this episode, we're focusing on testosterone replacement in women using bioidentical hormones either through pellet or subcutaneous or skin application. When you talk about anabolic steroids, which are injections of testosterone that are typically synthetic, we can raise the testosterone levels in women to basically equal men's. And we know that we do that with transgender patients that want to convert. And we all know that woman that wants to be a male and has a beard and has broadened chest and has a deep voice. Those are typically incredibly high doses of anabolic steroids. We use minuscule amounts of that level for our patients here at Hormone Balance. So therefore, you do not have masculinization symptoms such as hoarseness of the voice or widening of the chest, etc. So the answer is no. Subcutaneous pellets or topical testosterone does not increase the likelihood of masculinization in women.
Okay. Does testosterone cause hair loss?
Well, hair loss is a very complex issue. It's multifactorial, which means there are a lot of different factors that cause it. And actually, to be honest, the true etiology of hair loss is not completely understood. And there's multiple different types of hair loss. The most common reasons are either genetic or hormone deficiencies or vitamin deficiencies such as iron or thyroid deficiencies. And typically, if you replace those deficiencies, you can improve hair loss. Now, testosterone specifically does not cause hair loss in women with genetic predisposition for that. For example, there's a hormone called dihydrotestosterone in which a patient can be incredibly sensitive to and have male pattern baldness. The testosterone that we use does not do that. So we do not increase your propensity for hair loss. In addition, most women that seek hormone replacement therapy are somewhat older, typically over the age of 55. And statistically, 1/3 of these women will already have some thinning of the hair. So a lot of people say that the relationship is because of the replacement of hormones, but it's not that. It's because their patient already had a predisposition to hair loss. So subcutaneous pellets of testosterone does not, it's disproved, cause hair loss.
All right. Does testosterone have adverse effects on the heart?
That's a great question. A lot of people feel that hormone replacement therapy increase your risk of cardiovascular events such as a heart attack or blood clots, a stroke, etc. And there's overwhelming evidence that testosterone replacement in both men and women is cardioprotective. So what that means is that it actually protects your heart from a cardiovascular event such as a heart attack. And a lot of people feel that, well, since men have a higher risk of cardiovascular events or heart attacks than women, and they have higher testosterone, that their relationship is causal. And it's not. It's never been proven to be that. And actually, it's quite the contrary. Studies show that people that have a low testosterone, such as men, have an increased risk of a cardiovascular event. So therefore, testosterone is cardioprotective in both men and women.
Alrighty, next one. Does testosterone cause aggression?
Great question. So testosterone in itself does not cause aggression. What causes aggression is the balance between testosterone and estrogen. Any human that receives testosterone, the human body wants to convert it or aromatize it to estrogen. That's the word that we use. So the testosterone and estrogen balances are really important. Now, people that typically have aggression with testosterone is because that balance is not properly controlled, and they either have too low of estrogen or too high of estrogen. We know that low testosterone typically causes increased anxiety and irritability, grumpiness, aggression. Replacing testosterone typically ameliorates those symptoms and improves them. So therefore, testosterone in itself does not cause aggression. It's a balance of testosterone and estrogen that does.
Okay, last question. Will testosterone increase risk of breast cancer?
Great question. So the reason that question is asked is because we know that some breast cancers are hormone sensitive, which means that typically estrogen can stimulate a breast cancer or is the cause of the patient's breast cancer. Well, we are giving testosterone, and testosterone has shown the complete opposite. Testosterone is shown to be breast protective, which means it decreases the incidence of breast cancer and decreases the recurrence risk of breast cancer if you've had breast cancer in the past. Now, the tricky part is, as I mentioned earlier, testosterone does get converted to estrogen. So you have to be really careful in those specific patients, and you can block that conversion with a medication called an aromatase inhibitor. So therefore, women with previous breast cancers that are estrogen receptor positive, in specific cases, can use testosterone replacement to ameliorate all their symptoms. Is there any more?
That's it. That concludes our questions.
Well, as I mentioned, my name is Dr. Gonzalez from Hormone Balance of Laredo. We talked about the potential myths and misconceptions of using testosterone in women and the most common questions that people ask us. I hope this was informative for you. And if you think you have some of these symptoms and are interested in testosterone replacement, come see us.